And let's provide assistance for those that don't have the wherewithal to buy it. We have in America, albeit inefficient, albeit expensive, a system of universal access to health care today. We don't have universal health insurance, but we have a system of universal access to health care. And let me describe how that works. We have Medicare for the elderly. We have Medicaid for the poor and disabled. We have, now, if you go into an emergency room, whether or not you have money, you have the ability to, under federal requirements, to receive all appropriate screening and subsequent treatment. Now, what are the problems with this system? Well, number one, if that uncompensated care is cost shifted onto the rest of us. And to be eligible for some of these programs, if you don't have insurance, you're going to have to spend down your assets to be eligible. So I think what we need to get is to do to do things to focus on price competition, transparency. Why not have national standards whereby insurance carriers have to break down their costs so that we can do cost comparisons from one to the other? I mean, it's a 4 aspirin job to read a health insurance policy. It's tough stuff. So we can do a lot of things that provide consumer protections. Let me tell you about defensive medicine. We need tort reform. We have to stop this system of jackpot justice, whereby defensive medicine is practiced in every possible test that's given, just to curb litigation exposure. Before I go on, let me just mention a couple of people that are in the audience tonight. Commissioner Jim Dyer, Arapahoe County. Thank you so much for coming out here. Commissioner Rod Bockenfeld, thank you for coming out here. And who am I missing? Am I missing anyone? Okay. Well, let me talk a little bit again. Let me go over my concern about the public option. And first of all, the first bill that the president signed was what we call the S-chip bill, which is the health insurance bill to expand health insurance for children. Now, I supported a reauthorization of the current program, but a description of how when somebody in Washington tells you that something is budget neutral, I'm going to show you why you should have some suspicion about that comment. That in the S-chip program, what essentially did is said, let's insure children. So the existing program was for children at or near the poverty. And so the new program was to go 4 times the poverty limit. So a family of 4 making $80,000 a year was now eligible for this public assistance health care program. And states were allowed income disregards to take it into the 6 figures. So it was no longer a health insurance program to help low-income children. It was now to middle and upper middle-income children, people that vote, for families that vote. To make the numbers work, it's quote-unquote budget neutral. So it's budget neutral by doing a 60-cent tax increase on a pack of cigarettes. I'm fine. That's okay. Sorry for the people that smoke. However, to make those numbers work required going to the Heritage Foundation on this one, because the Congressional Budget Office, what the Congressional Budget Office said was it takes 2.4 million children off of private insurance onto the public roll. And so if you do project the math forward, given the fact that the tax increase would cause some people to quit smoking, that to make it budget neutral, based on the projections of the number of children that would be enrolled on the program, the projection, that it would take about 24 million new smokers Now, we're spending a lot of money already to get people to stop smoking. And so, but that's the problem. So when somebody tells you in Washington, when the president says that this program will be budget neutral and we will exact savings from Medicare, well, how? And it would be great if we would say, well, let's do that first and show us what that looks like.
Yes.
We're the Congress of the United States, trust us. Because seniors are concerned. Because so much spending, quite frankly, on healthcare is at end of life. And so what are we going to cut? Are we just going to cut provider rates or are we going to ration? We just don't know. We don't know because we're supposed to buy into the program and then see what happens. And I think that the American people are not there, not that trusting, not now. And so, you know, with that, I hope that we can arrive at a position in the middle and say that we need health insurance reform, that we need more price competition, that we need a private market, health insurance market that works under a framework of government regulation,